Hi all, welcome to EJU's online education program. It's about nurses who are preparing for the exams to the Gulf countries like Oman, Saudi, Bahrain, Kuwait, etc. So many of the candidates are having difficulty to study the theory because of the duty timings. They are not able to attend the online live classes or offline classes. And many of them, what they do is that they by heart the materials which they get from the social media and they directly go for the exams. As a result, they are not able to score the proper required score for their exams. For all these problems, we have found a solution, which is EJU's online app. Okay, so mostly the pattern of the question is that there will be a scenario, and below that there will be 4 options, and we have to select the correct answer. So most of them, because of the lack of theory knowledge, they are not able to select the correct answer. Okay, so we are providing a solution for that. In the question discussion section, we not only provide the right answer, we explain about the condition and the rationale of the right answer. Okay, so we have uploaded classes in addition to these question discussions in our app. So it is easily understanding, so that it helps to clear the exams properly and you will score high marks. If you study the materials and the question discussion properly according to our instructions, we assure that you will get the required marks and you will pass easily. Okay, coming to the features of our online app program, it is a 35 hours online class in which there is HD video classes which we have already recorded and uploaded in our app. And second, we also have PDF materials in which there are questions which have come recently for our exams. Okay, and third thing is we have mock test, so that you can practice questions and you can check that how far you have improved your knowledge. And fourth, we have exam mode test, in which you can practice the questions just like how you prepare for your exam or how you attend in the exam center. Okay, so all this helps you to gain knowledge and also to score high marks. Okay, there are some additional features which we provide. First thing is that you will have individual faculty assistance. Whenever you have doubt, you can clear the doubts with your faculty who are available in online, or you can call them and you can clear your doubts. The most important feature of our app is that convenience. You can watch the theory classes according to your time. There is no time frame inside our app, so the duty problem will not be an issue. Whenever you are free, you can watch, and you can watch any number of time you want. Okay. Then recently asked questions. We have a WhatsApp group in which we discuss with the students or candidates continuously. We make sure that they are covering the topics properly, and we also provide them recently asked questions given by the previous attended candidates. Okay, and we are daily updating the questions inside our app, so please watch it. If you like this video, like, share and subscribe. Please share it to your friends so that they also get benefit from our app. So these are the facilities we provide. Thank you. Hi all, welcome to the question discussion session of EJU's Academy. So we'll go straight to the question. First question: a 16-year-old girl developed an infection over the surface of the heart after having her nose pierced to place jewelry. On admission, she had developed pyrexia of 38 degrees Celsius, a heart murmur and petechiae over the whole body. She was admitted to the hospital and treated with intravenous antibiotics. The nurse explains to the patient that she is at high risk for reinfection and provides discharge teaching on preventive measures. Which of the following would most likely require prophylactic treatment? There are 4 options: A. Pelvic examination, B. Dental care, C. Bronchoscopy, and D. Urinary catheterization. Now we will see the question in details. So what is the patient's problem? A 16-year-old girl developed an infection over the surface of the heart. So surface lining of the heart is called as endocardium. So infection is there in the endocardium, which is called as endocarditis. So before going the details of the question, let's see 2-3 points about regarding endocarditis. So as we said, the definition of endocarditis is an inflammation of the walls and endothelial surface of the heart. So, inner lining of the heart is called as endocardium, and when infection or inflammation occurs, it is known as endocarditis. So, one of the important point related to exam for endocarditis is risk factors. Risk factors for endocarditis is, most common risk factor is the patients with valve replacement surgery. Okay, valve replacement surgery patients who had valve replacement. And second is IV drug abusers, those who abuse drugs through IV, and third is structural defect of the heart, in which most common risk factor is patient who had valve replacement, second is IV drug abusers. And the second important point is that the port of entry, endocarditis occurs when the bacteria or fungus from the bloodstream enters the endocardium, and thereby it causes endocarditis. So, the port of entry is important. Most common port of entry or access of infection is from the oral cavity. So, any procedures, any injury or infection, it leads to the spread of bacteria from the oral cavity to the heart through the bloodstream, causing endocarditis. So, this is most important point. Most common port of entry of bacteria or fungus to the endocardium is oral cavity. Second is cutaneous invasion through skin or wound, and third is any infections. Fourth is any invasive procedures like procedures or surgery. So, what the important point is that common port of entry is oral cavity, and risk factor patient who had valve replacements. So, now coming back to the question, patient developed infection over the surface of the heart, and as a result patient developed pyrexia, heart murmur which indicates valve involvement, and petechia means red spots or lesions which is spread over the whole body. What happened? She was admitted to the hospital and treated with intravenous antibiotics. So, here comes the question part. Nurse explains to the patient that she is at high risk for reinfection. There are chances for reinfection, and provides discharge teaching on preventive measures. So, question is, which of the following would most likely require prophylactic treatment? So, out of the four options, out of these four procedures, during which procedure requires prophylactic antibiotic treatment? So, we discussed that most common port of entry of organism to the endocardium is through oral cavity. So, when you see the options, A pelvic examination, B dental care, C bronchoscopy, and D urinary catheterization. The option which is related to the ports of entry of endocarditis is oral cavity, just like we discussed, and from these options there is one option remaining related to oral cavity, which is option B dental care. So, while giving dental care or while doing any procedures on the teeth or oral cavity, you should be very careful that you should prevent infection, or you should treat the patient with prophylactic antibiotics to prevent the chance of reinfection. So, answer is option B dental care. Next question, a patient with an allergy to cats arrives at the emergency department with symptoms of pruritus and difficulty in swallowing after visiting someone who has 3 cats. In addition to confirming airway patency, which of the following is it most appropriate to prepare the patient for? A intravenous line insertion, B intravenous glucocorticoid, C subcutaneous epinephrine, and D application of ice on the throat. So, what is the problem of the patient? Patient has pruritus, which means itching, and difficulty in swallowing. When did it occur? After visiting someone who has 3 cats. So, what is the history of patient? Patient is having allergy to cats. So, a patient who is allergic to cats visited someone who has 3 cats and developed reaction which indicates allergic reaction or anaphylactic reaction. These are the symptoms indicating allergic reaction: pruritus, which means itching, and difficulty in swallowing. Because during allergic reaction, severe allergic reaction or anaphylactic reaction, there will be edema on the upper airway and in the nose and lips as well, leading to airway obstruction. So, first priority of a patient who is having anaphylactic reaction is to maintain airway patency. Here patient's airway is already maintained in addition to performing airway patency. So, airway is already cleared. Question is, which of the following is most appropriate the patient prepare for? So, after maintaining airway patency, what is the most important action you should perform? So, after airway patency, the most important action for a nurse is to treat this anaphylactic reaction, which is by giving the antidote for allergic reaction or anaphylactic reaction, and the antidote for anaphylactic reaction is epinephrine. So, if you see the option A, intravenous line insertion, intravenous glucocorticoid, and C, subcutaneous epinephrine. So, this is the most important management for a patient who is having anaphylactic reaction. So, answer is option C, subcutaneous epinephrine. Next question, a patient treated an insect bite with traditional alternative therapy of raw garlic juice which caused strong skin reaction. The patient agreed not to use it again after the nurse explained its harmful effects. Which of the following is the best expression of the nurse's role? So, here the question focuses on the nurse's role, which comes under nursing administration. We have discussed in the theory that regarding the several roles of nurses in the hospital. Here the scenario is that patient who had an insect bite, instead of going for medical treatment, patient chose an alternative therapy, which is raw garlic juice, and what happened? It caused strong skin reaction. So, what did the nurse do? Nurse explained to the patient about its harmful effects, and after hearing the explanation, the patient decided not to use it again. So, what is the role of the nurse here? This is the question. So, whenever a patient makes a negative decision or a wrong decision, the nurse who helps the patient to take positive decision by giving them proper advice is known as nursing advocate. So, a nurse who helps the patient to make positive decisions by giving proper advice is known as advocate. So, advocate means those who give advices. So, here nurse has given advice to the patient regarding harmful effects and patient agreed not to use it. So, the nurse's role is patient's advocate. So, option A is the right answer. You can see 4 options: A, patient's advocate; B, resource person; C, care planning; and D, caregiver. Because the patient has given the advice to the patient to take positive decision, answer is patient's advocate. And next question, an 80-year-old man has Alzheimer's disease and increasingly has frequent episodes of dementia during which he does not remember family members' names and is not oriented to person, place or time. The healthcare provider speaks with the man's son about becoming the medical power of attorney for his father, who is no longer able to do this for himself. Which 2 elements of informed consent does the father lack? Option A, autonomy and fidelity; B, confidentiality and justice; C, competence and comprehension; D, voluntariness. So, here patient is having Alzheimer's disease, and because of that patient is having dementia, in which the patient does not remember anything, family members' names, and is also not oriented to person, place or time. So, what the doctor did? The healthcare provider speaks with the man's son about becoming the medical power of attorney for his father. Power of attorney means the right to make decisions for his father. Why? Because the patient, his father is having memory loss and he is not oriented to place, person or time. So, the question is, which 2 elements of informed consent does the father lack? So, it comes under ethical responsibility, it comes under ethical responsibilities, which is also under the nursing administration. So, here the father is not able to do this for himself. So, ability to make decision for himself is called as autonomy. So, the power of the patient to make decision regarding the treatment is called as autonomy, which is lost by this patient because of his condition, which is Alzheimer's disease. So, patient lacks autonomy and fidelity. Fidelity means trust or belief which a patient is having towards the healthcare provider. Okay. We can see 4 options. B is confidentiality and justice. Confidentiality means maintaining client details as a secret, and justice means you should prioritize the patients according to their conditions, not according to their external factors like economical or political or any other influences. You should prioritize the patient according to the severity of the condition, which is known as justice. And competence and comprehension. And D, voluntariness. So here Alzheimer's patient lacks 2 ethical rights, which are autonomy, which is power of making decision regarding treatment, and fidelity.